Hi, good morning, Mabel. My name is Mirang Jordan. I'm your invigilator for the OAT speaking session on the 12th of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Mabel Rooney.
And what is your candidate number, please?
My candidate number is 223800107.
Thank you. And you were taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you create a rapport with other nurses and doctors?
I love working on a team, with a sense of purpose. And being part of any healthcare team has always given me true meaning and incentive. I try to remain selfless, flexible, and dependable. When a fellow nurse once asked me to look after her patient for an hour, while she attended to a personal emergency, I ran over to the hospitalist to get briefed on the patient, and I was then able to care for him, in addition to the other two patients under my care, by foregoing my lunch hour. Of course, the team was very grateful, and I knew they'd do the same for me.
When you suffer a setback, how does that emotionally affect you and your work?
Everyone handles the stress and disappointment of setbacks differently. Experiencing a setback is always disappointing, and can be a bit disheartening. But, I understand that it happens from time to time. If I experience a major setback, I will take a few moments to debrief with my manager, and discuss what I could have done differently. Then, I move on.
Have you had the opportunity to teach an important skill to a coworker?
I have had many opportunities, in my career, to teach important skills to my coworkers. Because I am more seasoned, I am often tasked with training interns, newly registered nurses, and other junior team members. I am known as a catheterization specialist in our ward. So, that is one particular skill that I train often. The same goes for IV device training. I look forward to show my leadership skills in action, years ahead as well.
Would you say you are a better verbal or written communicator?
A clinical nurse specialist must be highly skilled in both written and verbal communication. I am comfortable with both. So that, it would depend on the message, I suppose. Urgent news needs to be communicated verbally, and followed up in written form, but quick messages on simple changes can be communicated effectively through email or instant message.
What type of nursing tasks do you find least desirable or most challenging?
I'm sure that every person has a task in their workday that they dislike. Overall, I would say that I least enjoy long and drawn out meetings. I like being on the front lines helping my patients, and I sometimes get frustrated if time is wasted in meetings that don't impact my work. I fully understand that gatherings of staff are important for training, educational, and other purposes. So I try to take any opportunities I can get in meetings to make them a learning opportunity for me.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Hi, good afternoon, Mihiraa. I am your attending nurse Mabel Rooney here. How do you feel now?
Good afternoon, nurse. I am feeling okay now.
Good to hear that, Mihiraa. Well, could you please explain to me in your own words how you were doing after the removal of the urinary catheter?
Yeah, sure. I have a bit of pain in my abdomen, but it is manageable.
Okay, that's fine. It's been 6 hours since the removal of the urinary catheter. May I know whether you have passed the urine?
Oh, actually, I haven't passed any urine yet.
All right. Mihiraa, you said you have experienced manageable pain. Can I have a few details about the pain, like the onset and any treatment done, and of course, if any other information you would like to share regarding the pain?
Sure, I will. The pain started not long after the catheter was removed. But it isn't that bad. So I haven't had any treatment.
Noted, Mihiraa. Now, I would like to know how you have been hydrating your body. So, could you please share to me how much quantity of water you may have taken during this period of time? And also the time of last drink.
Nurse, I have had 2 glasses of water every hour, and the last one was half an hour ago.
Thank you for sharing the information, Mihiraa.
Nurse, I was hoping that I could go home now, as the catheter has been removed.
I can understand your concern, Mihiraa. I will talk to you in detail about the observations done during the trial without a catheter.
Okay, nurse.
Mihiraa, the purpose of the trial without a catheter was to ensure your bladder function has been restored and functioned as normal.
Okay.
Unfortunately, the trial is a failure. Why I say the trial is a failure is that no urine passed since the 6 hours after the removal of the catheter.
I had consumed water in regular intervals. Now, what could be the reason behind that, and what can be done, nurse?
Don't panic, Mihiraa. I will address all your concerns and explain them to you in detail.
Okay, nurse.
It is common to have this trouble for some patients. So, there is nothing to be alarmed about.
Oh, really?
Yes, Mihiraa. Now, I will outline the next possible steps for you.
Yes, nurse. I would like to hear about it.
I appreciate your curiosity. The best possible solution is to reinsert the catheter and get the discharge with a catheter bag. Then, have a retrial within 1 week.
Nurse, I really don't want the catheter to be reinserted.
I totally understand how you feel. Perhaps, there will be complications if it is not done.
Are the complications manageable like the pain I have?
Your thoughts are sensible, Mihiraa. Kindly listen to me, please. If the catheter is not reinserted, there are possible risks of urine to retain in the bladder, which is called urinary retention. If urine retention happens, it can have mild effects to even very serious health issues.
Oh, I see.
Mild health issue being the possibility of getting the infection, and may lead to severe health issues like kidney failure. If the urine accumulates too much, the walls of the kidney may rupture. Mihiraa, the most simple and most common way of managing your condition is to reinsert the catheter.
Nurse, I understand the risks. Nevertheless, what bothers me is that I am really not keen to go home wearing a catheter bag, and also, I am not sure if I could cope with emptying it.
Your concerns are quite reasonable. However, try not to worry. I will give the details of catheter management.
That will be of great help, nurse.
Mihiraa, it is a very simple procedure to empty the catheter bag. First, wash your hands well with soap and water to prevent infecting the urinary catheter and bag. Now, hold the drainage tube over toilet and open the valve. After draining the urine, clean the drainage tube with a disinfectant wipe and reconnect it. Wash your hands again. It's very easy to empty the catheter bag, isn't it, Mihiraa?
Yes, it is.
Also, if you need any assistance, community nursing support will be available for you. So, no need for any tension regarding this.
Alright.
I will also provide a leaflet, which contains the do's and don'ts of the procedure, for your reference.
That will be perfect, nurse.
Mihiraa, can I have your consent for catheter reinsertion, please?
Nurse, can I go home if the catheter bag is reinserted?
Sure, why not? You can go home after the reinsertion of the catheter bag.
Okay then, you may please proceed.
Thank you for your consent, Mihiraa.
Nurse, when I will have to come back to the hospital for the removal of the catheter bag?
Mihiraa, within 1 week, you have to come to the hospital to remove the catheter, and then, repeat the trial without the catheter.
Okay, nurse.
Mihiraa, you should return sooner, if you experience increasing pain, or in case of any other worries.
Sure, nurse. I will monitor the pain, but I hope that I can get the catheter removed soon.
Definitely, Mihiraa. I wish you a speedy recovery.
Thank you, nurse. That is the end of your OAT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.